Okay.
Okay, starting now.
Good morning and welcome everyone. We will wait just a couple of minutes as everybody enters the webinar room. Buenos días y gracias por estar aquí con nosotros en este webinar. Estamos esperando un minuto para lleguen más gente en las salas de Zoom. We have a few more people connecting, so we'll just wait one more minute. Esperamos un minuto más para que lleguen más gente. Hola, buenos días a todos y a todas y muy bienvenidos al webinar de la Organización Panamericana de la Salud para
Good
conmemorar.
morning to all of you. Welcome to this webinar organized by PAHO for the launch of this activity addressing violence against women. We have English and Spanish. I will be speaking in English, but some of you will be speaking in Spanish. We have simultaneous interpretation. It is at the bottom of the Zoom where you see interpretation. Just click on that and choose the language of your preference to receive interpretation, simultaneous interpretation.
Pan American Health Organization webinar in commemoration of the global campaign on 16 Days of Activism against gender-based violence. I'm Silvana Luciani, and I'm moderating this webinar, which will be in Spanish and English. There's simultaneous translation, as some of our presenters will be speaking in Spanish, and it can be located in the button on the Zoom at the bottom of the screen under interpretation. So this is meant to be a very interactive webinar, and we invite everybody to put their comments or questions throughout this webinar using the Q&A function, which is also located at the bottom of the Zoom screen. So thank you again for joining us in this session, and we're really pleased to have us at PAHO join the global community on this International Day and campaign to end violence against women during the 16 Days of Activism. And today we're really pleased to launch the first ever regional status report on addressing violence against women in health policies and protocols in the Americas, which allows us to have a closer look at some of the key indicators of progress that are in line with the commitments under the PAHO regional strategy and plan of action on strengthening the health system response to address violence against women. And so in this webinar, we're going to present the highlights of the report and then have a panel discussion with several of our government leaders from across Latin America and the Caribbean on what some of those promising practices and lessons learned in strengthening the health system response to violence against women and girls. And to open our webinar and to get us started, I would like to introduce the PAHO Director of Non-Communicable Diseases and Mental Health, Dr. Anselm Hennis, who's going to provide the welcome remarks for us. Dr. Hennis couldn't be here in person, so he has sent a video message.
Distinguished participants from member states, experts and partners, colleagues, ladies and gentlemen. It is my great pleasure to welcome you to the launch of the Regional Status Report 2022, Addressing Violence Against Women in Health Policies and Protocols in the Americas. We know that violence against women and girls is a serious public health and human rights problem in the region. According to WHO estimates, 1 in 3 women in the Americas has suffered physical or sexual violence in her lifetime, mostly by an intimate partner. Up to 66 million women and girls in the Americas are estimated to experience intimate partner violence at least once in their lifetime since the age of 15. This is unacceptable and must change. The sheer numbers of women and girls affected by violence in this region are particularly shocking because we know that violence is eminently preventable. In direct response to the devastating impact of violence on the health and well-being of women and girls, the governing bodies of the Pan American Health Organization, made up of ministers of health of its member states, were the first in adopting a regional strategy and plan of action on strengthening the health system to address violence against women in October of 2015. Since then, substantial progress has been made in developing and implementing health policies and protocols, in improving quality of and access to essential services for survivors, and in strengthening multi-sectoral collaboration. The regional status report that we launched today provides an analysis of these efforts and related lessons learned. It represents a major milestone for the region as it advances this important agenda. Today's launch is also noteworthy as it falls during the 16 Days of Activism on gender-based violence, a time to celebrate achievements, reflect on progress, and renew our commitment to change. It is essential that we learn from the experiences described in the report and that we expand progress in order to empower women and girls across the Americas to enjoy long and healthy lives free from violence. PAHO stands ready to work with countries and partners to take forward the findings in this report to strengthen prevention and response capacities in countries, and to continue to monitor and report on advances to prevent violence in all its forms. The launch of this report is a welcome opportunity to strengthen our collaboration with countries, partners, and experts. We look forward to exploring findings and lessons learned together. Together, we will end violence against all women and girls in the Americas. Thank you.
It's great. Thank you very much. That was Dr. Anselm Hennis, the PAHO Director of Non-Communicable Diseases and Mental Health. And thanks for the support from senior managers here at PAHO for this event and also for the regional report. So let us now unveil our first ever report. And for this, I'd like to invite Ms. Britta Baer, PAHO's Regional Advisor on Violence and Injury Prevention, to present the overview of the regional status report findings. Britta, over to you.
Thank you so much, Joanna, and good morning to everybody. I have the challenging task of summarizing the report in 10 minutes. So I want to encourage all of you to check out the report and the data by looking at it online, which is available. We'll add the link to the chat and really engage with the data. So this report is a milestone for us because we know that violence against women and girls is a major public health and human rights challenge in the region of the Americas with enormous consequences. We know that 1 in 3 women have experienced intimate partner or non-partner sexual violence. We know that intimate partner violence is the most common form, with up to 66 million women and girls affected in the region. And really in response to this major challenge, these shocking numbers, the region of the Americas has been advancing really the response to VOW. It was the first WHO region to adopt a strategy on this topic. And it has a lot to share. And this is really the aim and the context of this report. There are so many experiences that we have in the region, so many achievements, so many lessons learned, and so many common challenges that we are still all working on. I'm really pleased that we have representatives of Argentina, Panama, and Trinidad and Tobago here today who will share much more about the work that they're advancing at the country level, because this is really the aim of the report, to highlight all of the experiences of the region. We know that violence can be prevented, and we have strong and very solid mandates to take action in this area. I've already mentioned the regional strategy that was approved by ministers of health in the region of the Americas, which has really been the basis for this report, as well as the guiding tool to help us monitor achievements in the area. It specifically focuses This report specifically focused on 3 areas. It looks at strengthening in a set of indicators around leadership of the health sector and the response to violence against women. It looks at another set of indicators that target the quality of health services for survivors of violence. And a third one around the multi-sectoral response, including the role of the health sector within the multi-sectoral response to violence against women. The report looks at different types of data sources to really give us an idea of like how we're doing as a region in advancing this important topic. It draws on a survey of PAHO member states that was administered in 2020. And I just want to thank member states for responding to this, which was really the first step in giving us an idea of where we are. It then looks in more detail at policies, plans, and laws found through internet searches, through ministries of health, that were uploaded and analyzed through the global WHO Violence Against Women database that was recently launched. And it draws on some complementary data, including the UNAIDS National Commitments and Policy Instrument Survey data on post-rape care specifically, to really give us, to triangulate and really to give us the best possible overview of where we are. It looks specifically at 2 key aspects of policy analysis. On the one hand, on whether the document or the policy that member states have committed to exists on the topic of violence against women. And it looks at how the document addresses and mentions violence against women and girls. And I'll discuss this a bit more when we go into the findings. So one of the big headline findings of the report is that there are many, many health policies that address violence against women, which is a huge achievement, including when we compare to global data. About 83% of countries have some type of national health policy that includes when a policy exists, when a national health policy, including national health strategic plans, mention the issue of violence, it really sets the tone for leadership of the Ministry of Health and of the health sector on this topic. It frames violence as a public health priority that needs to be addressed by the health sector. When we look at the details of the policies, we see that there are still some gaps to be addressed. Only 63% of countries frame violence as a strategic priority in the health documents. So the first step is mentioning it. The second step is then to frame it as a strategic priority. So there we still have some work to be done in the region. An interesting development in this area is also that a group of Latin American countries have recently developed gender-based violence or violence against women health policies that specifically focuses on health leadership on the topic, which is a very interesting development that really frames the issue in a very strategic way and allows a lot of advancements to be made in the country. The second big milestone of a strong health system response is the sheer existence of a health system protocol that guides the response, that outlines services and care that survivors of violence must receive. And again, at first glance, the region is doing very well, with 60% of countries having at least one health system protocol. However, the devil is really in the details. We really need to look at the details of these protocols to understand and assess how the region is doing. And when we do this, it can really help us understand existing gaps in the health system response. Details are also really important when we think about in facilitating implementation. We don't just want a perfect written document, but we also want to see changes on the ground. So we looked at all of the health system protocols and assessed them for their alignment with indicators that member states have agreed to, as well as the evidence base and some of the key components of a health system protocol that should be mentioned in the text. And we see some differences. The 60% have gone down for most of the indicators into the 50s and 40s or even below. We see, for example, that many member states see confidentiality, the principle of confidentiality, for example, as an important aspect of the response to violence against women. But details matter. If it is not enough to just mention the principle as important for health workers to really be able to implement it and make this happen in the day-to-day interaction on the ground when they engage with women and girls that have experienced violence. Details can really help them understand what their role is. So it is not just about mentioning the principle of confidentiality. It's quite interesting to see that only 3% explain really that the role of the health worker is to explain the limits of confidentiality. So for example, when there is mandatory reporting, when there is communication to other sectors, or any other types of limits of confidentiality that might exist in the case of violence. When we provide this kind of detailed information and guidance to health workers, it makes a huge impact on their ability to provide the best possible care. So this is to give you an idea of some of the gaps that we still can fill as a region. 54% that recognize the principle of confidentiality in health sector RAW protocols is a huge achievement. But there's much more that can be done to really strengthen language and confidentiality in some of the countries. This is especially important. The level of detail really matters when it comes to sexual violence, where a fast response means that we can provide a quality response. Every hour counts when we respond to violence against sexual violence. We only have a limited amount of hours really to provide care. So providing very detailed, specific, practical information to the health worker in the health system protocol makes a difference, because it allows them to be very clear on their role and act quickly. And as we can see, while many health protocols address the RAW response, it's a lot less detailed when it comes to specific core responses to sexual violence. So again, there's a lot more to be done, strengthen the quality and the scope of health sector protocols. A third important area for the response to violence is around multi-sectoral plans. Of course, the health sector is only one player in a broader response that requires collaboration with different government sectors, but also with society and other actors. And again, the headline number, 80% of member states have some type of multi-sectoral plan, is a huge achievement for the region. And it really speaks to the engagement at the country level on this topic. But we also see, and we look more detail at the numbers, that many of these policies as plans either need renewal or they're expiring soon. So it really poses a big challenge to the region as we advance this agenda. The good news is that we have increasingly strong tools and guidance and experience that we can rely on. One of those tools is the RESPECT framework that we used as a guidance document to analyze multi-sectoral plans and see their alignment with the evidence base, because that is important. We want our interventions in a multi-sectoral plan to be as evidence-based as possible, as effective as possible, to maximize really our investment in this topic and make sure that we can prevent and reduce violence against women in all its form as much as possible, as fast as possible. And we can see here in the data that there still are many gaps to be filled in applying a comprehensive approach to prevention in multi-sectoral plans. Some areas are doing really well and are regularly mentioned by member states, such as issues of interventions related to schools, interventions related to awareness, interventions related to services. But other areas need our attention, where we can really strengthen attention to these interventions, such as economic strengthening, economic transfer, labor force interventions, economic empowerment, etc., where we can really make use of what we know now, what works to prevent violence, and strengthen that content in multi-sectoral plans and programs to prevent violence in all its forms. And the last important area that the report highlights is the attention paid to groups in conditions of vulnerability. We know that that we're talking about an extremely diverse group of women and girls, different ages, different social contexts, different identities. And we looked at the recognition, explicit recognition of these groups in policies and plans. And you can see here that some groups are mentioned by sort of around 57% of countries, while other groups are rarely mentioned, such as it was very interesting to us that pregnant women are rarely recognized as a particular group, even though evidence says that pregnancy is a particularly risky time where violence can continue and even violence can escalate. We also looked at, because mentioning these groups in terms of their risk and barriers that they may face is only the first step. We also looked at to what extent there's an understanding or reference to differentiated services that these groups might be offered. And numbers went down even further, more in the 30s, so you can read in the report, highlighting really a strong agenda for the region to strengthen attention to a range of groups in conditions of vulnerability. I should also mention that these 4 groups that we looked at are not all possible vulnerable groups. There are many other groups that we need to look at when we think about diverse and gender responsive approaches to violence. And there remains a large agenda for this region across countries to really strengthen attention to and adaptation of services to meet the needs and preferences of those groups that might be most left behind in countries. So just very briefly, many more details are included in the report, and I really want to encourage you to engage with the findings, ask questions, think about how it relates to the information that you have at country level, at region level, in your institutions, and really see it as a tool to help us understand of what we can do better in future. We've seen a lot of successes. The sheer number of policies and the sheer level of interest in this topic in the region is a huge achievement, and is an achievement that must be sustained. In the context of COVID, we've seen interruptions in services, interruptions in policies, and attention to this topic. So it's really important that the progress that we have reported today is sustained, especially if we take into account that many of these policy documents we looked at are about to expire, need renewal, and need to be sustained over time. But there also remains so much more to be done, and lots of opportunities to really work together and strengthen, share experiences, and strengthen attention to scope and quality of content and policies and plans in line with evidence-based indicators. There are so many tools that we have available that can guide us in this work, from clinical and policy recommendations to manuals to training resources and evaluation tools. And these are just some examples that you see on the slide that we can use to really strengthen quality and content, and as a result, the implementation of these tools. Of course, improvements in the number and content of documents is only one step in the broader agenda to address violence. We fully recognize this. And the report also makes reference to the need for these improvements to go hand in hand with broader efforts to strengthen the health sector response and the institutional capacity to respond and implement these commitments, including, for example, but definitely not limited to, training, budgets, and other tools. As I mentioned earlier, there are huge opportunities in this region to really improve attention to groups and conditions of vulnerability in the context of violence, in documents, in services, in guidance, in training, and and on the ground. I think this is an area where this region can really lead, and there's a huge opportunity to strengthen also dialogue across countries and expand our attention to these groups. And lastly, we really hope that this type of policy analysis that we launched today can be expanded in future, that we can use it to engage in dialogue with all of you, that we can use it to strengthen collaboration across countries and agencies and partners as a really important component of monitoring progress in this area. We're coming towards the end of the PAHO strategy on violence. It ends in 2025. So this is a really good moment to both accelerate our efforts, but also to reflect and think about what is next, what we can do more, what can we do strengthen, what we can do better. So I'm going to end here. The report is available on the website. Please engage with it. And any comments or questions would be very welcome. I'm very pleased that we have 3 countries that are sharing some of the things that are highlighted in the report as good practices. And I think there's so much more that we can learn from each other. Thank you so much.
Excellent. Thank you so very much, Britta Baer, who's our regional advisor on violence and injury prevention, for that excellent analysis of the violence against women policies and protocols throughout the Americas region, and for your leadership in this analysis and in presenting the highlights. As Britta noted, you can download the report. It's currently available only in English, but it'll soon be available also in Spanish. The link is in the chat. We encourage you all to please review it, understand it, and work with us, as Britta has called, for greater community partnership actions to help us strengthen the health system response to violence against women and girls. She noted that there are some positive highlights in the region, that the majority of countries, some 83% of countries in the Americas region, have already included violence against women in their health plans or policies. But it's also really concerning to us at PAHO, and I'm sure to many of you who are listening in, that only half the countries offer that minimum and essential first line of support. But as Britta noted, it's not just the quantity of policies and protocols that exist, but it's also the quality and the scope and the detail that is in those protocols that's going to improve the quality of care for survivors, and having those specific interventions and that multi-sector response with social services, police, education, just to name a few. And so, you know, we implore upon you those. We have almost 200 people connected with us today in this webinar. We have a great community of partners and leaders and advocates to please, we implore upon you to please work with us, work with the governments, work with civil society, work with the other UN agencies, but let's have this strengthened health system response to violence against women and girls. And so thank you again, Britta, for the excellent report, and please have a look at the report. We're going to turn now to hear from representatives from governments throughout Latin America and the Caribbean on what they are doing to help strengthen that health system response to violence against women and girls. We have a really distinguished panel of leaders who are going to speak about the promising practices in their countries. We have 3 panelists. We have from Argentina's Ministry of Health, Licenciada Candela Cabrera, who is the Director of Gender and Diversity. We also have from Trinidad and Tobago, from the Ministry of Health, Dr. Roma Bridgelal Nagasar, who's the Manager of Medical Research and Audit. And then we have from Panama's Ministry of Health, Dr. Delia de Yacasa, who's the Coordinator for Mental Health. This panel discussion is going to be in Spanish and English, so for those who need simultaneous translation, let us recall that there will be in the interpretation button at the bottom of Zoom, the simultaneous translation. So we're going to begin first by looking at the VOW policies. The PAHO Strategy and Plan of Action on Violence Against Women notes that integrating violence against women in national as well as subnational health plans and policies is a key starting point for really strengthening that health sector leadership on violence against women. So having such a reference in an important policy document like the health plan can really set the tone for future engagement of health actors on violence against women. It can help to establish that mandate, set the goals and targets for action, including priorities to strengthen access and quality of health services for survivors. And we know that in Panama, there has been a lot of work done in this area. So our first question is to Dr. De Casa to talk a little bit about the policies and guidelines that Panama has developed to address intimate partner violence and sexual violence against women and girls from that public health perspective to ensure that comprehensive approach. Dr. De Casa, over to you.
Muy buenos días. Gracias por la invitación a participar, exponer un
Good
poco.
morning, and thank you so much for your invitation to participate. I'd like to talk about the advances that we have attained in matters of policy in my country to be able to tackle violence by intimate partners, sexual violence, and others. One of the most important points that we have, and perhaps one of the important things, is a law that was passed in 2013. Thanks to this law, we have been able to prosecute these crimes of violence against women, but most importantly, we define several actions that should be taken within the health systems to stop violence, and especially to channel all the efforts so that they are considered as a public health problem, so that we can incorporate all of these points in the national plans for the health sector. Within the framework of this law, we were able to create a national commission of violence against women and children, female children. 16 organizations of the civil society are part of this commission. And then, of course, the Ministry of Health is there too. And thanks to this commission, we channel policies, we channel efforts to prevent and to prosecute and eradicate violence against women. Within this commission, the Ministry of Health, as the main driver of this effort, has established policies such as awareness, prevention, and detention of violence against women, and the allotment of resources to fight this violence against women, and also to introduce treatment against HIV/AIDS to those people that are survivors of this violence. So, thanks to the commissioned creation, we have been able to incorporate all the norms and standards of the Ministry of Health in different procedures, especially in care and rehabilitation. We can mention several important points, such as the prevention of violence and public hygiene measures, also to make sure that we consider the risk to which the population is exposed. And also we have a component on adolescent health. Also, the Ministry of Health offers friendly services to this population, and also care during pregnancy and care during sexual violence acts. And also we have a comprehensive women's health plan to make sure that violence against women is included there as a component. This is an important element. Also, we have a manual on the prevention of violence against women within a spirit of solidarity in the National Health Services. At this point in time, we have emphasized this problem as a compulsory reporting problem in the National Health Service. And we have paid a lot of attention to this matter, especially we have made the health workers aware of the importance of these topics, and also to report suspected cases of violence. And then, of course, we are dealing with sexual freedom, and then also the health of the older adults. Within this plan, in Panama, we have been able to work towards the eradication of violence against women. Thank you so much, and congratulations for this important important achievements, especially the important law that has been passed that is really important to control the situation.
So we're going to turn now to Trinidad and Tobago to talk a little bit about, as one of the countries that has recently launched its national clinical and policy guideline, which is a major achievement for the country. So Dr. Nagasar, can you talk to us a little bit about why it was important for the Ministry of Health of Trinidad and Tobago to develop the guideline and how it was achieved?
Good morning, everyone. Thank you very much, Ms. Lushani, for your question, and thanks for the opportunity to be here. So violence against women is a major public health issue in Trinidad and Tobago, with much of the public in support of addressing it. And to date, there were small-scale training initiatives, but no overarching framework to guide policymakers and workers in the health sector. As such, these guidelines fill this gap to assist healthcare workers in the delivery of improved quality of care and enhanced safety for survivors. Also, government's commitment is shown by the Prime Minister's appointment of a committee to address violence as a public health issue. These guidelines are aligned with the government of Trinidad and Tobago's commitment to achieve the Sustainable Development Goal 5 to eliminate all forms of violence against women and girls. Elimination of violence against women and girls is a public good that holds several significant benefits to individuals, families, and communities in Trinidad and Tobago. And the Ministry of Health is just one of the agencies participating in this multi-sectoral, whole of government, whole of society approach to violence against women. The Spotlight Initiative and the Pan American Health Organization, thank you, through technical cooperation and funding, have assisted the Ministry of Health of Trinidad and Tobago in the development of these guidelines and their implementation since 2020. So it's important for us to provide this as a public good for our citizens of Trinidad and Tobago. Thank you. Over to you.
Great. Thank you. Thank you very much, Dr. Nagasar. And we're just going to switch gears now and talk a little bit about the PAHO Clinical Manual on Violence Against Women and Argentina's experience. Argentina is one of only 2 countries in the region that have gone through the process of adapting the PAHO Clinical Manual and developing their own national manual for comprehensive health care in situations of gender-based violence. Así que la licenciada Cabrera, ¿puedes por favor hablar con nosotros?
Ms. Cabrera, could you please tell us about the objectives of this manual and how do you develop this manual in Argentina? Hi there. First of all, thank you so much for your invitation, for being able to share this moment with you and with everybody in the region, and to have your valuable comments and experiences. In Argentina, we have a legislative framework and a programmatic framework, which is very robust. And this has been in place for about a decade. And this gives us the conditions to be able to work in a tool such as the technical adaptation and the cultural adaptation of the original manual published by PAHO in 2014, and to have developed this manual, which is a comprehensive healthcare vis-a-vis gender violence and several tools to preserve health. This work has been going on for 2 weeks with the for 2 years with the participation of over 500 people, and also we have had the participation of several directors, such as the director for young people and for adult health. And we have a new chapter on comprehensive care to sexual violence against male and female children and adolescents. And this manual is framed within the national plan for the comprehensive protection of children, which is the National Plan of Action Against Violence. And this material goes beyond violence against women. And then within the framework of the Argentinian law, it has the violence against people as something that should be included as the right to be free from this violence in the Constitution. And so in that sense, this material is really advanced material, and this is, of course, in fine-tuned with the legislation of the programmatic areas in Argentina. Also in this process, we have had several consultants. We have a consultant group, interministerial group, formed by the Ministry of Women's Health and Diversity. For the past 3 years, Argentina has had this women's ministry to be able to implement these policies to make sure that we have diversity and gender included. And this is a very powerful tool for diversity inclusion. And also at the level of the Ministry of Health, we have had a long-standing record on public health of fighting against the violence and for the rights, defending the rights in reproductive health, the rights of sexual and adolescent health. And then this agenda has gone deeper, and then we now, for the first time in history, the ministry has a directory on gender diversity, and this includes all of these policies at the social and political levels, and we have been able to prepare this manual. This is the first agreement that we have in this matter with the Pan American Health Organization and the Ministry of Health of Argentina. And for us, it is a very important occasion because this allows us to establish a dialogue within the region, and as a desire to establish a dialogue and to share experience and to see how we can solve these problems, how we can generate situations that lead to health and to prevention of violence. As we said in the initial reports, all of this is cross-cutting in the different topics, health topics in the region, because we have reached epidemiological levels that are very high. So one more thing that I would like to share, I have used all my time, but I'd like to share one more aspect that is important in this material and has to do with working with the different health teams. Three, we have awareness, we have education, but awareness is very important, and it implies a transformation of the healthcare model, giving it a perspective of gender and diversity. So we have to make sure that this topic of violence against women is at the centerpiece. And also, this has an interdisciplinary nature. And then later on, I will explain a little bit more on this. Thank you so much. And first of all, my congratulations for this manual, and also for having created this section on gender and diversity. And as you said, within this context, you have really advanced a lot. Thank you so much.
So talking now a little bit about the experience that women and girls undergo when they've experienced sexual violence, we know that it's really critical to provide empathetic and non-judgmental care and support. And at PAHO, we recommend first line support, also known as ANIMA for its acronym, which is an adapted version of psychological first aid. We know that this is one of the most important interventions for survivors of violence. And we know that in Panama, for example, ANIMA has been used. So I'd like to ask Dr. De Casa, why is ANIMA and more broadly mental health care so important for survivors of violence, and what has been the experience of using ANIMA in Panama? Dr. De Casa.
En efecto, pues,
Yes,
para nadie es un secreto que las consecuencias
it is no secret
sobre la salud,
that
tanto
the
física como mental,
health consequences, both physical and mental consequences of violence, it creates a terrible impact on women. The emotional status of women, victims of violence, is really directly related to many effects that could go from the deterioration of cognitive abilities, also quality of life is affected, but then also it could cause mental changes. We're talking about depression, we're talking about anxiety, post-traumatic stress syndrome, panic attacks. All of these things lead to the consumption of substances and alcohol. Through the evidence presented many times, we have seen women and children that are known to us that they have suicidal thoughts and they are survivors of violence. On the other hand, also we know that those people that have a mental illness, because of their vulnerability they're created by this pathology, are at an increased risk of suffering violence. So this violence that is a two-way street, and it shows that mental health health workers should be able to tackle all of these signs of violence attacks. So mental health professionals many times within the health sector, within the health system, have women who come to them as a first contact after they have been victims of sexual violence. They are survivors of sexual violence and sexual violence. And that is important to consider because mental health should be incorporated when we respond to violence cases, and also to have protocols that allows us to identify violence systematically. This gives visibility to other problems that many times are overlooked and are behind violence. But then if we consider this, we can not only care for the survivor, but also to make sure that we identify the aggressor, and the aggressor should also be considered within mental health to make sure that that aggressor doesn't go from victim to victim perpetuating violence, because they replace one woman or one person after another, but the problem itself is not tackled. So mental health prevention is a wider concept. And so it is necessary to consider this in the guidelines and in the procedures that we have put into practice in Panama. So within the standards of care for mental health, we have included also a sub-program for gender violence that allows us to include in these actions, but with other tools, a program or programs to make sure that this is a comprehensive approach, because we have evidence of the importance that mental health is immersed in the entire topic of violence against women. Thank you so much, Dr. Icaza.
Holistic and comprehensive care provided to women and girls who've survived experiences of violence against women and girls. So thank you very much. We're going to turn now to the issue of data and data collection as a complement to ensuring that norms and quality assurance and quality of care are provided. It's an important tool to monitor and collect data. And in Trinidad and Tobago, with the approval of the new guidelines, we understand that health administrative data has also been strengthened. So the question is to you, Dr. Nagasar. Can you tell us a little bit more about why health records are important for survivors of violence and how Trinidad and Tobago is using the new guidelines as a way to strengthen this important area of work?
Thank you very much, Ms. Lushani. So yes, the clinical guidelines includes a clinical record form where information relating to the violent incident, the care and tests received, and the referrals that have been made are recorded. And this is an important tool to facilitate quality of care, as it takes the healthcare worker through the various steps needed to optimize care. The form can be used in paper as part of the patient's notes that already exist, right? And I'd like to go on further to state that an important innovation has been made, whereby the form has been developed into an electronic format, and it is based on the perinatal information system that is already in existence in Trinidad and Tobago, the PAHO, the SIP, right, the perinatal information system. So this is the first time in the Americas that a violence against women module of the perinatal information system, SIP, has been developed, and it is serving as a blueprint for other countries, right? So this module, this is a new module, the SIP violence against women module. It will improve the health system through this information communication technology health information system, which, as I said before, is the first electronic system in the Americas and the first electronic system for intimate partner violence, right? So in designing the system, consultations were held with frontline healthcare providers, medical records personnel, and other health stakeholders. So why is it important to have this electronic version as well as the paper-based version? This new module, it will help to enable the monitoring of the guidelines implementation, right? So the digitization of the information on intimate partner violence and sexual violence will facilitate management of care by different providers and avoid distress that may occur when the survivor has to repeat information about an incident of violence. Also, it can help to pinpoint areas of concern in the quality of care provided and enable targeted strategies for improvement for Trinidad and Tobago and hopefully for the region of the Americas as well. Thank you very much, and over to you.
Thank you, Dr. Nagasar. And I'm really pleased that the module on gender-based violence in the SIP has been applied in Trinidad and Tobago, and it is something that is a regional public good and available for other countries. So for those of you who are listening in and interested in improving data and data collection on violence against women and girls, please reach out to us at PAHO, and we'd be happy to assist in applying and implementing the module and learning more about the experience in Trinidad on this. Thank you. We're going to turn now to the issue of groups of people living in conditions of vulnerability and how policies and services need to be adapted and consider their needs. We heard a little bit about this in Licenciada Cabrera's presentation earlier, so I'd like to ask her to talk a little bit more about how Argentina has really made an effort to foster comprehensive care for women, LGBT plus communities, girls, boys, and children who are going through or have gone through situations of gender-based violence. Licenciada Cabrera, can you please tell us more about how Argentina has integrated gender and diversity perspectives in your work on the ground to make sure that nobody is left behind? Over to you.
Bueno, en ese sentido, la perspectiva de
Yes,
género.
in that sense, the gender perspective and diversity is a cross-cutting issue in the health policies. And we in our directorate work on that. And for that reason, the manual has been accompanied by a consultative group and strategic areas such as response to HIV, primary health care, youth health, and so forth. So in reality, we have reached a consensus. This has been an intensive work conducted over 2 years, and this is a work that requires consensus. And also, it also requires a look at the health service in system itself. Also, I would like to say something regarding the role of the health system in the detection of violence. We consider that this material and the policies that we have created, we believe that the health system is the first listening ear, the first attentive ear, the first tool of support to detect violence against women and children, and to see what the risk is and to establish the strategies within the framework of this material, and also within the interministerial and intercountry policies, the Ministry of Women, the Ministry of Education, the protection to health and adolescent system. So This requires intersectoral work. So the health system works and visualized at the political level is a system with a responsibility in its role. It has a privileged role and position to evaluate risk, to give proper care. And then here, we're not only concentrating on prevention and care, but we're also trying to concentrate on building spaces and creating services in an intersectoral way, to an intersystemic way, to make sure that we tackle this problem that has many dimensions, not only physical violence, but also symbolic, institutional, economic violence, and so forth. So in that sense, when we take a look at it, when we take an approach to it, it just goes beyond the health system, and it requires not only hard work, but also to articulate work at the interministerial level and the system, and also at the local, provincial, and national level, because the health system is centralized. And to be able to think that clinical materials or any other protocol, as I said at the beginning of the presentation, can have an impact in prevention of violence, it is necessary to use these policies and protocols.
Otherwise, the protocols are not powerful enough for the teams whenever they have them, whenever they know how to use them, but how do we get to the different territories to implement the health policies? So for Argentina, this process to develop the material has also been a process to establish intersectorial consensus, something that allows us to put together the levels and also to place clearly the role of the health service to address violence due to gender issues. And also when we are talking about gender-based violence, we find that this is not only in connection with the help of a woman or a girl, or just this focuses on the woman or the girl that is the victim of violence, but the sector as such is also the sector that has to work due to the inequalities among the parties, and also because of the roles they have. There are inequalities within the system, and they are not disconnected from the care that the health system, whenever we have that process to provide care, whenever someone is sick, generates violence based on gender. So, for example, we have violence in the obstetrics field, but also against other individuals whenever we create access barriers to those who have different gender identities. And finally, we have what we know as strict gender-based violence, as we have heard so far. The other issue that I think is also important to clarify is that as part of this multidimensional situation, violence is a health determinant, but it is not exclusive as a health problem, but it is also a cultural, political problem that is a result of the inequalities and the patriarchal society. So we are trying to address mental health from the point of view of the community, something that should not just isolate the problem and create violence as a pathology, that should not think of violence as just a psychological problem. So we need to think of this as a problem that is not just exclusive to a woman or someone who is a victim, but a problem that commits us all as a society. I would like to share with you a goal that the feminist movement has in Argentina, something that is very strong. And from our own country, we are promoting these policies. We really treasure the fact that we need to convey to women that women are not alone. A woman that is a victim of violence is not alone. This is a problem that it belongs to all of us, and this is a way in which we focus on care and also on addressing this from the point of view of a network.
It is a social issue, and we need that all of society and all of government approach to respond, and recognizing that the health sector has a really critical role, being often the frontline care providers for survivors of violence against women and girls. So we have now come to the end of our hour. I really apologize because it's such a good conversation and such an important topic for us, but we will have to unfortunately conclude our webinar now. But I encourage everybody to please check out the regional report. This is the first ever regional report on the assessment of violence against women policies, protocols, with some clear recommendations on how we as a region, through PAHO, through governments, through civil society, through other UN agencies, can have a stronger health system response to violence against women and girls, as well as strengthen that multi-sector response to prevent and respond to violence against women and girls. So I just want to thank everybody, especially our panelists, Dr. De Casa, Dr. Nagasar, and Licenciada Cabrera, for sharing your experiences from Panama, Trinidad and Tobago, and Argentina. I would especially love to thank Britta Bear for that excellent and very comprehensive review and analysis that has led to this regional report, and for her leadership on violence against women and girls in the region, and for helping us advance. And I'd like to just thank everybody who's been connected, almost 200 people from throughout the region. Please stay in touch with us, work with us, help us improve violence against women and girls in the region. So thank you, everyone, and have a great day.
Bueno, muchas gracias por la invitación.
Thank you very much.
Muchas gracias.
Gracias.
Bye, gracias.
Muchas gracias.
Bye.